Hey, everybody. This is Chris
and Cathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Cathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
We're talking about bicipital tendinitis. Basically, that's tendinitis of the biceps.
Welcome to Petability. I'm your host, Cathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Chris, what's going on today?
Oh, not much. I ran a bunch of errands, took the dogs for a walk.
I'm having a rough day today. I don't know what it is. You ever have one of those days where just everything goes wrong? Like everything you touch just goes wrong. Not patient-wise.
I actually have those quite frequently.
I was having a bad day, so I stayed in my pajamas for a portion of the day, and I'm just downing Skittles, like I'm just pouring them into my mouth, right? But there's a fly that's following me all around the house. I've called him Kevin. I named him Kevin. I'm telling Kevin to get out. I'm giving Kevin a chance. I open the window. Get out, Kevin. Kevin won't get out. So, I'm still, eating my Skittles and going about my day. Decide I better take a shower. I go into the shower. There's Kevin dead in the shower, right? I'm like, oh man, Kevin. In one hand, I got my Skittles in the left hand, and I just take a piece of tissue paper with the other hand, and I pick Kevin up. Kevin's not dead. He flies out of the tissue paper, and I jump, and I tossed all of my Skittles into the toilet.
Whoa! And you saw the rainbow.
And I saw the rainbow.
Please tell me you didn't try to fetch your Skittles out of the toilet.
No.
You draw the line at the toilet, thankfully.
I draw the line at toilet Skittles, but I'm going to perk up because we're going to be talking about something that we both see a lot of, and maybe we can enlighten our listeners on bicipital tendinitis, specifically in dogs.
We haven't really talked about tendinitis yet on the show in over 4 years. So it's high time. We selected this because I think it's a tendinitis that's easier to maybe grasp for people, but let's start with a little anatomy. So we said we're talking about bicipital tendinitis. Basically, that's tendinitis of the biceps. The biceps is on the front of your dog's forelimb. Ironically, bi means 2, tri means 3. In dogs, because they're weight bearing, their biceps only has 1 muscle belly and tendon at the shoulder. Whereas in people, there are 2 muscle bellies and a short tendon and a longer tendon. And conversely, the triceps in dogs actually has 4 muscle bellies and we have 3. So being the egoists that we are as people, we name the muscles by being upright bipedal creatures and not on all 4 quadruped creatures. But, that kind of tells you folks where the muscle is and how it differs from people. We use it in what's called an open chain fashion. So That is the primary muscle used, for example, to like feed ourselves, right? We're flexing the elbow and supinating, which means putting our palm up. The bicep in the person actually is the main supinator. So if you're sitting there listening to this podcast, turn your palm up and then feel the front of your upper arm, your guns, if you will. And you'll feel it contract and relax as you turn your palm back and forth. So many people don't know that and just think it's used for lifting, but also for turning the wrist over.
In the dog, it's fairly easy to locate on the inside of the greater tubercle of the humerus. So the humerus is the long bone of the shoulder. Just in the front of the shoulder, if you put your finger there in the front of the head of the shoulder, you'll fall into like a little groove, and it's right in that little groove.
Right. And at the point of the shoulder, right, is what you want to find first.
Right.
And then go to the inside of that, like toward the chest, just slightly.
Right.
And that's where it could be tender. That's where that
Right.
tendon that typically flares up. So let's talk about what itis is, right? We're talking about the biceps, where that is. Tendons connect muscle to bone. That's why we're pointing out where the tendon is. So the biceps, the muscle belly, is in the center of the upper segment of the dog's forelimb on the front side, cranial side. And then the tendons are responsible for connecting that biceps muscle to its bony attachment.
Think about the forelimb and how common injuries are in the forelimb. When you think about the weight bearing of a dog, right? So a dog is going to normally weight bear 60% of their weight on the front of their limbs and 40% on the back. And so the front limbs provide the primary support needed for activities like standing, walking, and running, and braking and turning. I used to work with a physical therapist before you, Chris, if you could believe that. There was another. And she said, Cathy, even a healthy tendon can be, tender on palpation. And she palpated my biceps tendon. And I was like, yikes, that is uncomfortable. And so even a healthy tendon could be a little bit touchy on palpation.
True. Very true. Itis means inflammation of the root word. So, when it is inflamed, consider, like you said, it was kind of ouchy, when it was healthy and normal. And when it's inflamed, it's going to be, super angry and super ouchy, potentially, if you're on the right place. And I think that, you said it's fairly easy to palpate. That hasn't necessarily been my experience. Maybe I don't have,
it's easy to find.
Yeah, but so you pet owners out there, may have more difficulty, but give yourself some grace on that. A few other things, you talked about 60% of the weight being on the forelimb. Couple that with the instability based on the anatomy of the shoulder joint. It's a ball and socket joint. The socket isn't a deep socket. It's not like the hip joint, which typically covers over 50% of that ball. In the shoulder, it's more like this ball kind of abutting more like a dinner plate or something. And the stability really relies upon the muscles around it. So namely the deep muscles or the rotator cuff. So when you think about the name itself, right, it's a cuff of muscles that reinforces the joint capsule of the shoulder joint. And there are 4 muscles. What's interesting is that some people, even in the human world, because as you mentioned, I'm also a physical therapist for people and work primarily in sports medicine. Some folks consider the biceps as that 5th rotator cuff muscle because it wraps up and over that shoulder joint. It actually crosses 2 joints. So it is responsible for stability, as we've implied, at the shoulder. It crosses the elbow and is responsible for bending the elbow in the dog. So I think that it's been my experience that any muscle that crosses 2 joints has a much greater predisposition for having strains. And it is important to say it's a strain, because a strain is disruption of fibers or a pull of a muscle or tendon, contrasted with a sprain that is an injury to a ligament. Ligaments hook bone to bone. And remember, a tendon hooks muscle to bone. So strain, sprain. The other thing that's, I think, really interesting, I don't know, I geek out on this stuff, Cathy, right? Is that dogs don't have a clavicle or collarbone. So again, this is maybe responsible for even less stability at that shoulder joint than a person.
So we talked about stability. The biceps tendon helps to stabilize the shoulder joint, especially when the dog is like in this like neutral position. And then the biceps tendon, it allows for flexion of the elbow and extension of the shoulder. Now think about all of the movements that your dog does during the day. Think about this. If you went to the dog park, could your dog even do a play bow? Because if they had biceps tendinitis, and how it just has this rolling effect. So the shoulder's not stable. They're not able to extend the shoulder. They're not able to flex the elbow. They got to do that for stair climbing. They got to do it for running. They got to do it for playing. So this can be a really complicated, complex injury that has a lot of consequences.
I guess one of the reasons, of which there are many and we'll talk about, but it's a frequent cause of forelimb lameness in dogs that are active, working breed dogs. Because I've worked with several of these that were like hunting dogs and such.
Right.
And if they're working in like marshy or mucky conditions, wet fields, their foot can post hole and get kind of stuck in that muck. And so this is one of the times where they're having to work extra hard because it's almost like suction, right? It's
right. If you've ever got your boot stuck in the mud like that, when you try to pull it out, it just
and you lose your shoe.
Yeah, you lose your shoe. Yeah.
So they're having to do that repeatedly over and over and over again as they're traversing this mucky ground. So that's really causing extra strain on that whole system that they, normally in walking on, hard, flat ground, they wouldn't experience.
Right. Usually I see them in agility dogs or hunting dogs or herding dogs that are very active. Also commonly larger breed dogs, so it could happen in any breed.
But even, you mentioned agility and, so they're jumping, over these obstacles and, doing various, potentially repetitive work, but the slipping, the potential slipping when they're going, 100 miles an hour around an agility course, that can also, because what happens, we talked about it being a 2-joint muscle, is the muscle is contracting because it's trying to stabilize the shoulder and weight bearing. They're advancing the limb forward. So they're bending at the elbow to clear. And then something, it slips from beneath them. So the muscle's contracting, but then it's pulled in the opposite direction because they slip on the floor or, something similar. So that sudden lengthening as the body's contracting, well, you got equal opposite forces, tugging, and that can cause definitely an injury.
Right. I have some patients, I believe, that have tendinitis that are secondary to conditions like osteoarthritis. So if there's degeneration of that shoulder joint, or if there's instability already at the shoulder joint, or if there are osteophytes and when they're moving and extending their shoulder, I feel like that tendon's just rubbing over those osteophytes and causing pain and inflammation.
Yeah, it certainly can, especially there's another tendon, the supraspinatus, and then the biceps, because they kind of wrap over the top. And so they get trapped between the shoulder blade bone there at the tip and that ball joint of the humerus. And, you mentioned osteoarthritis. We typically think of that with dogs that are aging due to relative inactivity or something called sarcopenia. It happens with aging that they just start to lose muscle. So then you're going to have more inherent instability at that joint because it doesn't have a lot of bony stability. We just recently talked to somebody in flyball, and I was thinking about the potential of overuse and things like that, those quick turns, the technique being so important for those flyball athletes. And so any active dog that's doing a sport, that's doing something over and over again, or something that happens traumatically, it could be a jump, it could be a fall, it could be an awkward movement, simply getting out of the car, that can set things off. And then you have, like you were talking about, the degeneration and underlying conditions like osteoarthritis, leading to more tendinitis over time.
More tendinitis, yeah. And the clinical signs can kind of vary, I think, depending upon the severity of the tendinitis. The onset of tendinitis to me seems like it could be gradual in the early stages and progress over time. So maybe you have a dog that's lame one day and they rest for a few days and then, they look a little bit better and then they go and play ball and they're lame again. And that lameness becomes sort of this intermittent, lameness, and then it becomes sort of this more consistent lameness of that affected forelimb.
And if you suspect, I mean, obviously you want to take your pet to the vet sooner
Right.
than later, right?
Right.
And get an appropriate diagnosis. But, if you're trying to figure out, because oftentimes it's hard to know which leg is it, is it
Right.
a forelimb or a back limb?
Even
And then
even
if
with us, even with us, sometimes we're like, is that the front or is that the back? And historically, what I see with dogs that have forelimb lameness is they'll bring their head up. They're pulling their head up versus when their rear leg is bothering them, where I see a head bob. Does that make sense to you?
Yes,
they're
but
trying to
I've even been confused by that, Kathy, because I think sometimes it's the timing of the head bob. They may bring it down and when they're loading on the back leg, and then when it comes time to load on that painful leg from that lower position, they really exaggerate
their
that
head
coming up.
Yeah, they
So
bring their
I
head
see both down and up, and I'm like, okay, is it time with the front limb or the back limb? And
Now your head is spinning. It could be bicipital tendinitis and compensatory related. Who knows?
it could be a CCL in the back. Yeah, who knows?
So again, it's this is why it's so important to bring them to the veterinarian, and so that we can localize where the pain is coming from. Sometimes I elicit a pain response in dogs when I will flex their shoulder and extend the elbow, and then they're like, "Oh, I don't like that." So that gives me some kind of indication as to maybe is there pain localized to the shoulder.
So I want to review a few of these things.
Okay.
If your dog has a head bob, something's hurting, especially if
Right.
it's a new onset. So they're using their relatively weighty head, because it weighs a lot relative to other parts of their body, to try to offload the painful limb when they're walking.
Mhm.
Then we talked about where you could feel it. So, now let's say, you figured out it's their front leg, but you don't know which one. You could feel for that groove on the inside of the tip of their shoulder and see if there's tenderness there. Other signs of inflammation besides pain and tenderness would be, does it feel warm? Is there relative swelling? That's hard to detect in the shoulder.
Right.
But oftentimes what I will do is I have the dog stand in front of me. I kind of gradually, very lightly bring my hands to the front of their shoulders. And I try to see with my eyes closed, does one side feel fuller? Like where that groove is it more dense? Is it more poochy? Is it fuller? And then the other side, there's a pretty significant deep groove there. So that will tell you that there's some swelling along that tendon in that groove. And then finally, you're talking about a test. So I think this is really important for people to know. So the action of the biceps is to bend the elbow and extend the shoulder. So extending the shoulder means bringing it up toward the head. Okay. So you may not be familiar with the terms flexion and extension we've been throwing around, but flexion means bending and bringing the angle of a joint more acutely together. Okay. And extension means moving the limb away from the body and opening up space in a more obtuse angle. So it's bending the elbow and bringing that whole forelimb up toward the head. So when it's angry and inflamed, you do the opposite to try to stretch it. So the first thing I'll do is, with the limb bent and relaxed, just comfortable, I'll bring the elbow back along the dog's side and I'll see if there's a reaction there. If I don't get any reaction, then I'll very carefully and gradually try to straighten that elbow back toward the dog's stomach or rear leg. Many dogs will react to that just because it's an unfamiliar movement. Mm-hmm. And so you can adjust your hands, you can, whatever, but try to repeat it a few times for validity. But the important thing is compare it to the other side. Do you get the same reaction? Because if it's not a biceps tendon, then they're just nudgy, you're going to get a similar reaction on both sides. But if it is an inflamed biceps, that will really set them off.
And then I think there are other diagnostics that we can include here for patients' ultrasound. We can look at the soft tissue and detect tendon inflammation.
I'm just going to interrupt here because most vets typically start with x-rays as kind of a rule out?
Well, let me finish what I was going to say. Well, not if you work for a radiologist. If you suspect tendinitis, we're going to go right for the ultrasound, because you can actually see the integrity of the tendon. And you certainly want somebody who's done a lot of ultrasounds on tendons before, it's to skill. And you can actually see disruption of fibers on the ultrasound. You certainly can do x-rays, and what that will rule out is fracture or other bony involvement, such as osteoarthritis or osteophytes around the tendon sheath. And then you go, oh, I see osteophyte, or I can see bony changes that make me think that there's osteoarthritis shoulder joint. And that may also be like putting it together. So it's a guideline. So we're not going to get really a good indication of what the tendon looks like radiographically, but it can lead you to the diagnosis based on what the shoulder itself looks like. And again, ultrasound, I think, is going to be, your key, because we can really look at the integrity of the tendon in real time under, ultrasound.
So I thought that MRIs and CT scans were really effective at looking at soft tissue. So
it is. Yeah. Oh, yeah. No,
Okay.
it definitely is. I think that, and I think that you probably would get very good results from looking at an MRI or CT scan. The only thing is they're so expensive.
Right.
You're so expensive, and you're really committing financially to a lot of testing.
Yeah. And I was kind of playing devil's advocate there, because I do think that those are typically reserved for later down the road. If the lameness is chronic, it's intractable. You're not getting the results that you'd like with the treatments. And so then maybe taking a closer look via one of those. And I mean, a lot of times it depends on what the vet has at their disposal. CT scan versus MRI, I think both can be effective. And then when does a joint tap come in?
If we have inflammation of that joint, it's very possible your veterinarian may want to perform a joint tap, also known as arthrocentesis, on a dog to collect synovial fluid from that joint for diagnostic purposes. And this procedure is useful for dogs that present with symptoms like joint swelling, lameness, pain, or stiffness, which can be caused by various causes, such as infection, immune-mediated diseases, or joint injury. And what we would do, or what the veterinarian would do, is insert a needle, carefully inserted into the joint cavity. And they're going to collect some synovial fluid by sucking out the cells, and then we're going to analyze them. They're looking for things like a sepsis, so a joint infection, immune-mediated conditions like polyarthritis. And some of these conditions, like we just talked about, polyarthritis or bicipital tendinitis, they often have a very similar presentation. With polyarthritis, you're probably going to find it in more than one joint, but your dog may come in looking like a dog that has biceps tendinitis, and maybe they have polyarthritis.
And again, your vet can help you explore those things. But as you implied, poly meaning many, arthritis. So arthritis in many joints. And when that, happens and it's in all these joints without cause necessarily, then that's when I think they start thinking about it might be an immune mediated condition, versus, maybe a wear and tear to a knee joint after a CCL tear or something like that, where it's more obvious.
And so where does that lead us for treatment options, Chris? Once we've determined that this patient has bicipital tendinitis, what are our options?
Well, I think, as you implied, it depends on where they are. Is this the first time that they've had this lameness? Is it mild, or is it recurrent, happening over and over again, or is it constant and severe? And, we talked about the progression. So we definitely want to catch it early. Do not ignore signs like reluctance to, jump or run or any of those higher level activities. Watch for soreness after some of the predisposing things like agility or herding or hunting. I think the first thing that we always think of with a musculoskeletal injury is rest. And oftentimes that rest, to decrease the inflammation, because it's caused by overuse, causing some wear and tear, is coupled with maybe some anti-inflammatory medication.
And I know that the rest is always difficult. Believe me, I know I had to rest my dog after surgery, so I know that this is a difficult part of recovery. But when I think about human anatomy versus the dog's shoulder anatomy, there really is no great way to rest the dog's shoulder other than to confine them. If you and I had something that we needed to rest our shoulder for, maybe we could put it in a sling, right? But as soon as the dog stands up, their shoulder muscles are engaged. So this is a difficult thing to do. And I understand because I've had to go through it. And I listened to a lecture many, many years ago that was given by Debbie Taraka, who is one of the founding persons of the canine rehabilitation program. and has been a mentor to many of us. It's her recommendation that these dogs may require 2 to 3 months of activity restriction. And that's a long time in dog mind, right? To
Well,
me.
right.
Yeah. And I think that's where sometimes it breaks down because, maybe at that 6-week mark, you're like, oh, my dog is better. She looks better. And then you let them, do something. They run or they walk or they do something. And then you've sort of started the process all over again.
And they will do something because they are feeling better. So,
Right.
we have to be the voice of reason. So just because they're feeling better and that inflammation is diminished, it doesn't mean that the tissue inside is healed. And we'll talk a little about that too, like what that looks like. So, simply letting them go down the stairs or, that one time they go out in the yard, off leash, that can be the straw that breaks the camel's back after weeks or months of good progress. Yeah. You said you've had to confine. I just came off rest with Julep for 2 weeks. I must admit I cheated. Don't tell the surgeon, but after a week she was doing so great.
You better hope she doesn't listen to our show.
Again, Dr. Beth, her primary, said that she was healed, but man, it was just 2 weeks.
Right.
I can't imagine. And she's 8 and she's little, it's not like she's a 1-year-old lab or Aussie or border collie or, something like that. So to your point, Cathy, yes, we empathize with how difficult that this may be, but don't cheat.
Yeah. And if you have to rest your dog like that, this might be the time to maybe do just a little bit of like environmental enrichment with the dog, maybe in a sternal position they have, using their snuffle mat or something like that, something that can engage them mentally that might take away some of that or mental expenditure that will make them tired versus running them.
Cathy, we're in luck because Lori Chamberlain, who is the educator for the Fear-Free movement, just disclosed to me that she's working on a new course. And the title is something like How to Keep Your Dog from Going Crazy After Surgery.
Yes, Lori. Yes.
Which would fit here too. But she's going to have a lot of ideas about enrichment and safe things to do. Her poor little border collie had knee surgery. So anyway, stay tuned for that because I think it's going to be coming out in the next couple months or so.
So for us, when we get these patients, our goals, I think Chris would probably, start with or include inflammation reduction, range of motion, breakdown or elimination of scar tissue or that fibrous restriction. And then when the pain is gone, then we can start moving into the strengthening of the shoulder and returning to function.
I think we just kind of seamlessly glided into physical rehabilitation because nobody is better equipped than your physical rehabilitationist to tell you how to gradually lift restrictions, when it's appropriate, how to do it, because sometimes it's not intuitive and things that we think are not a big deal are a big deal. And the physical rehabilitationist sees your dog regularly, right? So the vet may send you home, with marching orders, rest your dog. Well, what does that mean? So, we can guide you through that. And then also, as you say, Cathy, during the treatments, we're working initially to decrease the pain and inflammation, restore range of motion, restore flexibility, and then working on strength and finally power, like that, the quick motions, the fast twitch muscle fibers and things like that. And finally getting them back to the activities that they love. And, hopefully that's possible.
Chris, why don't we talk a little bit about some of our options for treating bicipital tendinitis? I think there are many modalities that we can use that will help the patient. One of the first things I think of is ice massage. I think it's very good for inflammation reduction. And it's very simple. I'll just take a Dixie cup, I'll fill it with water, and I'll put that in the freezer. And when the patient comes, I'll take it out of the freezer. It's frozen, and I'll peel back the cup a little bit and use that ice, and I'll move it around the head of the shoulder and into that groove where the tendon lies. And the trick, of course, is to keep it moving. We don't want to put the ice directly on the skin and hold it there. We're going to move it. We're going to move it around the head of the shoulder. I think that's an excellent option for reducing inflammation in your patient with bicipital tendinitis. And it's typically tolerated very well. And I'll usually stick to about a 5-minute treatment. And this is something owners can also do at home.
Yeah. And people we used to say, tell me when it gets numb. It could be 5 minutes, it could be 8 minutes. Some of the research is showing some differences, though. We've always thought about ice as, and it is, cryotherapy or ice therapy, cold therapy is an anti-inflammatory, but that acute stage of inflammation usually only lasts about 48 hours. Mm-hmm. And certainly we can set it off again. So it could be recurrent, right? We talked about the dog doing it, or maybe in physical therapy, their activities. We want to cool it down, right after exercise. But heat can be great for improving circulation to the area. And that is something you'd want to wrap around the whole shoulder girdle, because all those muscles work together. We talked about the rotator cuff before, and they all need to have that blood flow to bring nutrients to the area to promote healing. And whereas that ice massage, which I also love for discrete areas, is very targeted. So you could get right on that tendon. And then the other great thing that also kind of warms up and promotes blood flow is massage, massaging that area. So we use our hands a lot as rehabilitators.
And then the other thing I'll do is some deep friction of the biceps tendon. And that deep friction, or the idea of doing deep friction, is to either soften or even, perhaps break up that inflamed scar tissue that's restricting the biceps tendon. This is hard to explain without a visual, but I'm going to do the best that I can. And maybe we can get some video, Chris, that we can put up on our YouTube channel for our listeners to see. When I'm preparing to do deep friction massage, I will take my middle finger and cross it over the top of my index finger. And then I'll get right on the head of the shoulder and deep friction into the groove where the tendon lies.
You want to go one direction, strum, and then lightly go back, and then strum and lightly go back and strum. It's almost like plucking a guitar string. So earlier I kind of insinuated that, we talk about what the tissue actually looks like after being injured and inflamed. And if you imagine, the fibers of the tendon should run in parallel. So it's almost like if you were to cut a electric cable and you have a whole bunch of individual wires, running within that cable. That's kind of like how the tendon is, but in cross section. But when you have an injury, it gets all twisted and crisscrossed and gunked up. And as Lori McCauley said in her fascia podcast, sticky, right? And so things aren't gliding like they should. Right. So one of the main points with a lot of what we're doing, but particularly the deep friction massage, or I call it cross friction massage, is that strumming helps to realign, reorient those fibers in parallel. So an analogy that I was told in PT school, and it's always stuck with me, is you have a pile of pickup sticks and they're just in a mess on the table, right? And you start and that's the injured tissue. And you start rolling your hand across that pile of pickup sticks. And before you know it, all of those, as you're rolling your hand in the same direction, back and forth, all of those pickup sticks are going to start to align in a parallel fashion. Yeah. So you're facilitating that healing in that way. And in turn, because they're linear, that's the line of stress. That's where they need to be strong. They're not going to be strong if they're all crisscross, and they're not going to be, they're going to be shortened, and, it's going to be more prone to re-injury and things. But if you realign them, it lengthens and makes it stronger to tensile forces.
Think of all my cable wires that are all tied together and how short they are now because they're all tied together in a knot.
Good analogy as well. Yes.
And then, of course, this is, I think, a good time to mention our friends at Medco Vet, because I think laser therapy and light therapy is going to be very effective for treating patients with bicipital tendinitis.
Yes. It promotes healing primarily in the case of the luma by decreasing inflammation. So it all starts there. And then we did a whole show on shockwave. Really great modality for tendinitises and some of those hard to treat diagnoses.
I feel like shockwave might be becoming, the gold standard, honestly, now that they've sort of improved the technique for the shockwave machine where it's not as uncomfortable and it doesn't take as long, and animals are tolerating it really well. And I've had patients respond very well to the shockwave treatment. So definitely go back and listen to that show if your pet has a tendinitis, because I think that we're getting really good results with that.
Absolutely. And earlier we were talking about how difficult it is to rest your dog or restrict activity. And our friends at Dog Legs have that special hobbling system.
Right.
The very comfortable gear that goes across the shoulders and the back, and then cups the upper segment, and then wraps around the upper segments of the legs, and then has a little strap to restrict how large each step can be. So it's not like they're taking little baby steps, but it doesn't allow for the legs to splay or, to stretch in awkward or unusual directions. So again, it's a relative rest, and just having the device on can give your dog a signal. We always talk about those stimulus cues, like, oh, nope, we're going outside. We're going to go for a little walk so you can do your business, but you're not going to go running, so having that on and, kind of gives you another set of hands and a way to promote the healing.
Right. And these can all be used together,
Oh, yeah.
Your shockwave treatment and following with laser therapy and using the dog legs for support and stability when you're out, with your pet.
So when it comes to exercise, let's say we've done all this, like you said, the pain, as far as we can detect, because our dogs can't talk to us, but as far as we can detect, it's gone and we're not seeing the signs of inflammation. But now we need to start, putting some stresses and strains on that tendon to get it back to, quote, normal, right? If you put your dog in a bubble and never build them back up to, their previous lifestyle, then they are going to hurt themselves the first time they take off running or something. So, we've got to very strategically and gradually and slowly start to exercise them.
Right. Walking, a great way to exercise your dog in a functional low impact exercise. And then what I'll do with walking is eventually I'll start, if these dogs are not having any pain, is I'll turn the walking into sort of like downhill walking. And I think that helps that downhill walking helps to strengthen the shoulder.
It absolutely does. And, even when we're doing exercises in the clinic, we can do what I call isometric exercises. So basically the dog is in a static position, but you're asking them to work. So you said before, as soon as the dog stands up, they're having to engage those muscles.
Right.
That's an exercise. But then what if you have them stand on an unstable surface? So they're not moving, they're just standing there, maybe getting a treat, and you can, maybe make their head go to the right, the left, up and down, but they're on like a foam cushion or a very low inflatable type of disc or bones. They have some of these things out there for folks to purchase, but then you're going to be engaging those stability muscles even more.
Do you ever do modified push-ups with these dogs once they get to a stage where they're not painful? So instead of going all the way down to the ground and then push back up, I have them go halfway, maybe where they're flexing their elbow and push themselves back up. And usually I lure them with a treat, I'll get them.
Yeah.
And sometimes I'll do that on, the balance disc, even depending on where the dog is in recovery.
Right.
Again, it's just sort of come down, flex the elbow, so just have to engage those shoulders, muscles, and then have them push themselves back up. And they don't even know they've done a push-up. They're just following the cookie.
Right.
They have.
Right. But what's cool about having them on a squishy surface is you can see where they're bearing their weight.
Right.
Are they putting it all on the quote good leg and really not using the bad leg? And if that's true, then they're not ready for that. And when you describe, doing, having them come down and bend a little bit in that front area and then come back up and then doing it on a squishy surface, that's called linking an exercise. So, first you'd start on a stable level surface, and then you can do on, a slight incline or put them on something that moves or is squishy. So there are ways to gradually build it up. And then again, that's where your rehabilitationist comes in and can help, guide you in that process. One of the things that I learned, Cathy, as a physical therapist with people is that there's something called, I mentioned isometric before, and that basically means that the muscle stays at the same length, right? Because they're not moving. There's also concentric and eccentric types of exercises. Eccentric really targets the tendon. Now, again, this is hard to do in our animal friend. I just want to explain it so folks out there can get the concept, because it's really important. So again, eccentric targets the tendon, versus the muscle for more tendon strengthening. So we talked about in people, it's, you take a weight, a barbell, and you have it in your hand and you bend it up to your shoulder, right? The typical biceps curl. When you are lifting the weight, the muscle is shortening, the angle is getting more acute. So you're flexing that elbow. That's concentric. That's what we think of when, see bodybuilders going to the gym, that sort of thing. But what goes up must come down. So the eccentric phase of that is you still have that weight in your hand. Now you've got to put it down. So the muscle's still contracting. If it wasn't, you're going to just, drop the weight. Your arm's suddenly going to straighten. So the muscle is still working, but it's lengthening. So concentric, the muscle shortening as it's contracting and you're lifting. Eccentric, the muscle is lengthening as it's contracting and you're extending. Did that make sense?
It sure did. Yeah.
To your point, some of the ways that we can work on eccentric in a weight bearing sense. So in a person, going down the steps is going to be eccentric lengthening of the thigh muscle, the quad. Going up the steps is going to be concentric. So the same thing can be done with dogs. Now we just have 4 feet, right? So we're working on typically eccentric motions when they're going down. So you mentioned going downhill, bringing the dog down into a partial or modified push-up, or eventually going downstairs, and everything you want to do slowly. You break it down into one component and you start at a slow speed. Then over time, as you're getting closer to return to normal activity and sport, you do it at a faster speed. So maybe that dog just goes down one step and then they go down a short flight slowly. Then they go down a full flight. Then they do it a little bit faster and faster. And then, you can tell when you're pretty much out of the woods, although there are never any guarantees.
Yeah, no, there isn't. Yeah.
And I see in our outline here, Cathy, you wrote concentric strengthening would be, walking, swimming, high stepping, because you're flexing that elbow, especially with swimming. Dogs always want to bring their paws out of the water. So you're really bending that elbow, or high stepping through grass or over cavalettis, rails. Yeah.
Let's talk a little bit as we're getting closer to the end of the show here, Chris. Let's talk just a little bit about some other medical interventions that you might see in a patient that has bicipital tendinitis. We talked about using laser and shockwave and so forth, but they're also using stem cells or platelet-rich plasma to help with these dogs with bicipital tendinitis.
We're using these regenerative treatments more and more. So, I think that folks have kind of gotten used to hearing the terminology stem cell, which is basically a blank cell that's introduced to the body and then goes to the area that's needed.
And they transform themselves into the cells that are needed to repair tissue damage.
Yeah. Platelet-rich plasma, on the other hand, is removing some blood from your own pet or dog and putting it in a centrifuge, spinning it really fast, and then injecting only the platelet-rich plasma versus the other components of the blood.
Right.
So these platelets have, again, a restorative component to them as well. And it's less expensive and more accessible than stem cell. Stem cells have to be preserved, like cryotherapy and things like that. And there's only a few facilities that actually provide them. Whereas a lot of veterinarians now in general practice and such are offering PRP. Usually it's not a single injection. Sometimes it has to be done 2 or 3 times.
Yeah. And then I see some patients who get corticosteroid injections. I have mixed feelings about that. And I'm not a veterinarian, so I can't speak for what is the best course of action for your dog. But I think that initially it seems with my patients that it does certainly help, reduce inflammation. I feel like it has its limitations though. I feel like, it wears off and maybe the dog's back to where they were before.
And I think with these injections that are steroidal because that's like a big gun to decrease inflammation, it's a fairly large needle and that can be traumatic itself. And so they're trying to avoid the tendon. Oftentimes they use the ultrasound that you were talking about, I think, to kind of guide and know where to do, but they want to bathe the inflamed tissue in the drug as opposed to injecting it directly in the tendon. that can cause the tendon to rupture potentially. And, one of the limitations too is that they don't want to repeat those. You have to have a period of time in between and maybe do it a maximum of like 3 times. You talked about it has the potential to come back. I think one of the things that happens in all medicine, including with people, is that rarely, unless you're getting to the root of the problem, it's like this steroid masks the pain. What caused that inflammation in the first place? If you're not treating the root cause, then it's likely to come back. So again, it's a means to an end. If it's so painful that you can't do anything, you need to reduce that pain to allow you or your dog to do the things that are necessary, that are indicated to promote healing and, improve the biomechanics around the shoulder, get to the strengthening component, whatever it may be. So if the inflammation is intractable, I think that there is a place for these injections, but not without, concurrent rehab and other therapies. And I just want to make a point. We talked about 2 different injections here. One, the corticosteroid is to decrease inflammation. The platelet-rich plasma and stem cell therapy injections are different. Those are regenerative versus introducing an anti-inflammatory drug. Yeah.
Right. And then, in severe cases, I have had some patients who have had to have surgery, and the surgeon has sort of snipped that biceps tendon and transfixed it to another part of the bicep, or release the biceps tendon to retract and relieve tension. And so it's not in that groove anymore. And, those seems to be reserved for some, for the more severe cases. I hate to see a patient lose their biceps tendon because of its function, and that's something you'd have to discuss with your doctor and your surgeon. But there is a surgical procedure that can be done that releases that biceps tendon.
I think of that, I have mixed feelings about this one. I think that as more of a salvage procedure. Yeah, if all else has failed. And unfortunately, I've gotten cases referred to me for rehab after that tendon has been snipped. Right. And that dog never got any rehab or prehab, if you will, beforehand. So, I wasn't sure that, I wasn't sure that all avenues had been explored in a more conservative sense. And, oftentimes it's very successful when they do the tenotomy and cut it, because you're just releasing that painful, tendon, and there's no tension across it. So no inflammation. But this dog I'm thinking of in particular was a young chocolate lab, and he was not doing well. And it was a really, really tough case for me.
Yeah. And then the good news is, I think that the prognosis for dogs that have mild to moderate cases with the appropriate rest and treatment, I think these dogs can recover well. It's the chronic and more severe cases that go into sort of more prolonged treatment and waxing and waning. And maybe even these dogs are the ones that have to be evaluated for surgery in these more severe cases. But I think these mild to moderate cases, although frustrating, with appropriate treatment, can do well.
Yeah, you just have to be so patient, patient.
Right.
Because the more it waxes and wanes, each time it flares up, the likelihood of success is lessened.
Right.
And I learned in PT with people that, however long the signs or symptoms have been there, it usually takes at least twice as long for the recovery. Oh. So, if you're dealing with a little bit of lameness, for a couple of weeks, and you start rehabbing, whatever, usually, 4 to 6 weeks, they could be, pretty good shape. But if it's been going on for months, it could take, over a year for things to get better. Right. But like you said, each time it gets injured again or flares up, you're kind of starting at ground zero. So, our point here is to let our audience know, what you may be dealing with, giving you appropriate information and expectations. And as Cathy always says, the more you know,
the more you grow.
That's right. That's right. So just trying not to be, not to be negative in any sense, but, just getting all the options and information out there.
Right. Right. And there are things or preventative measures that we can take with some of our patients who are agility or performance dogs or hunting dogs or high level dogs, high activity level dogs. With regular exercise and conditioning our patients or cross training, we can help prevent those overuse injuries.
Oh, I love the idea of cross training. Right.
I love cross training, Chris.
Yeah. swimming and, like you said, the enrichment activities and working on, specific strengthening exercises, targeting, the area you want to target, and then warm ups and cool downs, which people often avoid, so important.
And we talked about it in the fly ball one that we just did. We just talked about the importance of preventing injury with these dogs, and they do warm ups and cool downs, and in between they're exercising and conditioning and cross training. That's how they're going to prevent those injuries. Yeah.
Early in the show, we talked about the conditions that they're performing in too, so making sure there's good traction, making sure you're not, if it's muddy and mucky out there, maybe don't do it, or do it a shorter period of time. Really be vigilant and watch your dog. And as always, Cathy, what helps most musculoskeletal
don't be
problems? Fat. Weight management.
Don't be
weight management. Don't be fat.
Don't be fat.
And I don't think a lot of these dogs are, that we're talking about, but, even taking off a pound or two and keeping them super lean can make all the difference in the world.
Absolutely. And more injuries are bound to happen with an animal that is too heavy for whatever you're asking them to do. If you think about you're doing agility and you have a heavy or overweight dog, that's a lot of repetitive concussive forces on the body. So weight management.
Right. And also, maybe asking your veterinarian, early on, let's say you get a puppy and you have aspirations of, doing herding with them or something like that, or agility, ask them if your dog is loosey-goosey, I call it, or ligaminously lax. So each being, people, animals, we either have really tight capsules and those ligaments that we talked about that hook bone to bone. And so, they're stiff, and those are the kinds of beings that need more stretching. Or on the other end of the spectrum, if you're hypermobile, you have lax ligaments that allow a lot of play between the bones. We already talked about the anatomy of the shoulder being relatively lax compared to other joints in the body. Maybe not doing these repetitive high impact activities with that dog as you'd hope, are there ways to modify it? Not to say it's impossible, but, just be smart out there.
Yeah. And there are other ways to have fun with your dog. You can do other competition sports like nose work without having that high level of, activity. So I think that, the takeaway here, Chris, is like we said, bicipital tendinitis is a manageable condition with early detection and appropriate treatment. And for active dogs, that long-term care and preventative measures are essential to reduce the likelihood of reoccurrence. So don't discourage. It can be frustrating, but don't get discouraged.
I know we've alluded to, several other shows. We have, at this point, 123 shows that we've recorded since March of 2020. So a lot of good information there, people. We mentioned the Luma. We mentioned Flyball. We've got shows on all of this stuff, shockwave, laser. So please check them out. And we have a search engine now, a search function on our podcast. So you just put, a keyword in there and it should come right up for you. So tune in, tell all your friends and relatives. We're having a lot of fun doing this, and we hope you enjoy it.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.